Good afternoon, everyone. We'll give it just another minute or two here to make sure everyone has logged in, and then we'll get started. All right, we'll go ahead and get started. My name is Tony King. I am the Director of Pharmacy Programs for Mountain Pacific Quality Health. We are a subcontractor to the Montana Healthcare Programs, or Montana Medicaid. As of August 10th of this year, we will be taking over the physician-administered drug programs from Medicaid and going through our systems to look at your requests. So we have contracted with a company called Telegen to run those requests through their system, which is called Qualitrac, and that's what the training is for today. We are working with Telegen and using Qualitrac in different contracts that we have and have thoroughly enjoyed our partnership and relationship with Telegen, and our providers are speaking very highly of the Qualitrac system. So we have with us today from Telegen, Heidi and Ear, who will be doing the training. Again, all of our relationships with Telegen has been great, but Heidi has been first and on the front lines of working with us, and we truly appreciate her collaboration and her ability to work with us in getting acclimated with their program. So Heidi, I will turn it over to you at this time.
Great, thank you, Tony. And we feel the same about Mountain Pacific. We've truly enjoyed working and getting to know all of them. We're all very like-minded, which makes it easy to collaborate together. And without further ado, we'll go ahead and get started on the training. So this is the provider portal training for physician-administered drugs. And in today's training session, we will introduce you to Qualitrac. We will talk about the provider portal and how you actually access the Qualitrac system. We'll review how to submit a review request for physician-administered drugs, and then show you how to view the request status and ultimately to review the outcome of that review. And then we're also going to do what we call authorized official training. These individuals are folks who are authorized on behalf of your organization to manage users. Qualitrac is a web-based health management system that's built and maintained by our team of clinical and technical experts. We provide 24/7 provider access to the system. We've streamlined the review process so that all necessary information for a member is contained on one page. We call that the Member Hub, and you'll see that here in a bit. It provides secure electronic upload of clinical documentation and gives you as a provider the ability to track progress of any submitted requests. Beginning Monday, August 10th, as Tony indicated, users who have completed an authorized official packet and have received their credentials to log in will be able to log into the system and begin submitting review requests for physician-administered drugs. Providers will have access to the Qualitrac system via the provider portal. The portal can be accessed by this URL, and you'll want to bookmark that at some point. The training slides here today, as well as the recording of this training, will be also posted out at that site so that you can review it at your leisure. You'll use the login link at the top right-hand corner of the website, and you'll want to monitor the website for ongoing information. This is where they'll post information regarding not just the provider portal, but also things about the review process. This is the landing page and the portal sign in. So when you click on this URL, this is what you'll see. You click here on the portal sign in page or link. The provider portal utilizes what we call a delegated security model. And this just simply means that it requires an organizational executive, someone in your organization, to delegate the administrative rights to one or more individuals within your organization. Each facility is required to have at least one authorized official. And that, as I said, that authorized official is the point of contact for your organization should we need to communicate something. And this person can add, remove, or edit provider user accounts as folks come and go from your organization. Please note that due to HIPAA and DHMH compliance rules, we do require all staff entering reviews or accessing the portal must have their own login and password. Do not create generic logins. Your authorized official will create your user profile in the system. You'll receive an email with your username and a temporary link to the portal. You then just click on the link within that email and you'll be directed to a reset password modal where you'll enter that username that you received and then establish your password using the password criteria shown on that page. Password criteria is pretty standard across industries. You know, you're gonna have a alphanumeric and a special character. If you don't receive the email from your AO and you're expecting it, please check your junk email box and or contact your organization's IT department to make sure that it's not being blocked by your organization's security regulations. You do need to establish your password within 24 hours of receipt of that email. It will expire after 24 hours. Let's jump right into submitting a review request. Again, you'll go to this URL and click on the portal sign in tab at the top. That will take you to the sign in page. Here you'll enter the username that you received in the email from the authorized official. And then you'll use the user password that you've established that's unique to you, and then simply click sign in. You can see also on that sign in landing page, there is also this reset password link. This is where you would go to change or reset your password whenever needed, including if that for some reason you were not able to click on that link within 24 hours, you can just go use your username, click on this reset password, and bypass that 24-hour expiration. We ask that you not bookmark this page because the security around it would cause issues the next time you log in. You should always use this URL to access the system. If you do choose to reset your password, it'll just take you to this reset password modal and ask you to enter your username. And then our system will recognize your user ID and find the email associated to your account and send you an email with a link to reset your password. When you successfully log into the system, this is the Qualitrac landing page. You can see we've got two modules. We have care management within our product as well as utilization management. You'll use the UM panel. Throughout the Qualitrac system, there are navigational tools always at the top of every page. This Qualitrac logo will take you back to the landing page from wherever you're working in the system. The magnifying glass will give you search options. You can either search for a specific case or a specific member. These horizontal bars is the task queue. This is where you go to complete any to-do items you have, including requests for information if we've asked for additional clinical documentation. This icon will take you to our Knowledge Center. The Knowledge Center provides user guides, frequently asked questions, and tip sheets. And then this person icon here, similar to other apps that you use, is your individual profile page. This is where you can go to manage your profile, including making changes to your phone number, your email address, etc. So to get started, you'll go to the Utilization Management panel. and you'll either select Start Task, which would take you to that task queue, or you can click on Search. First, you'll need to find your member, so you'd click on Search. You'd enter the member ID and the date of birth. The member ID typically is the 9-digit number that your member provides to you. If for some reason the member ID and the date of birth does not match, it must match exactly in our system based on the information that we receive. If it doesn't, you'll need to confirm the information and try again. When it does match what we have in our system, you'll see the member information here with blue tint to all of these parameters. This is an active link. You can just click on any of these and it will take you directly to that information for that member. Clicking on that member link will then bring you to this member hub. This is that one-page area that organizes the request workflow and all the member information into several panels. Here you'll be able to view information related to the member, including his or her contact information and any review requests that have been previously submitted. The first panel is the member details. You can click here and it will provide information regarding the member. To minimize the panel, you'll click on Hide Member Details. Or if you want even additional information, you'll click on the View Even More Member Details, and it will provide information such as their member eligibility information as we received it on the file. Next panel is the Utilization Management panel. This will display information related to any review requests that have been previously submitted for this member. You can see here in this example, this one, someone started a physician-administered drug review for retrospective timing, but it's not yet been submitted. To add a new one, you'll just click on this Add button. The next panel will be the Authorization Request panel. The date and time of your request is completed here for you. The next section of that panel is the review type. You'll see a drop-down selection, and here you'll select physician-administered drugs. Next, you'll indicate the place of service. This is where the care is going to be provided or has been provided. And then you'll just select from one of the 4 options here in the drop-down. We'll also need to know the type of service. For this particular review type, you'll see prescription drugs. We'll also need to know the timing. The timing indicates when you are notifying us of this request. For physician-administered drugs, you'll see 2 options, either prospective or retrospective. Prospective is obviously a review request submitted prior to starting services, and then retrospective is a request submitted after all services have been provided. When all the selections are complete within the Authorization Request panel, you'll select Add New Request. You can also select Cancel if you've made the request in error. Next, you'll indicate the service start date and the service end date here in the Dates of Service panel. You can either enter it as the month, day, year option, or you can simply click on the calendar and a calendar will pop open and allow you to select the date there. Next panel is the Coverage panel. The Coverage panel will display information about the member's coverage and eligibility. You can see the Medicare indicator, third-party liability, and the EPSTED indicator default to no or not supplied unless there's information in our system from the state eligibility file that indicates otherwise. If within our system it indicates that the member does not have eligibility coverage, you'll be alerted by this yellow banner that the member is not eligible, and then you'll be required to provide a reason for why you're continuing your review request. The next sections ask for information related to the treating provider and the ordering provider. You'll simply click Add on each line to provide that necessary information. When you click Add, it will open a search box. You can search for providers by entering their NPI or by filling in any of the information boxes provided. When you've entered the necessary information, click Search to locate the physician or the facility. Clicking Search will return any results that meet the criteria that you've entered. You'll use the green plus box to the left of the name to select the provider or facility that you need for the review. If the ordering provider and the treating provider are the same, You can select copy treating provider to ordering provider, and the system will just pre-populate that second line for you. You'll now see the treating provider and the ordering provider information populated in the providers panel. You can select remove if you've made a selection in error. To ensure that all applicable end users within the care team for this request have access to the review in the Qualitrac system, we ask you to select that organization or facility within this provider organization visibility panel. This will allow anyone with access, in this case, anyone with access to St. Luke's Regional Medical Care or Medical Center would have access to this review request. Next is the diagnosis panel. This is where you'll enter the diagnosis information related to the review. Use the add button to add a new diagnosis to the panel. You can search by code or by term. Searching by code will let you enter a code directly here in the search box and search for it as shown in the example here, and then select search. The system will then provide a list of results to select from. You'll select from the one you want added to the review by clicking on the radio button to the left of that code. After selecting the diagnosis you want added to the review, you'll select submit or submit and add another. Submit will add the diagnosis to the review. Submit and add another will allow you to submit the diagnosis to the review and then reopen the window where you can repeat the process and search for another diagnosis. If more than one diagnosis is entered, you do have the ability to drag and drop to reorder them. I could simply click here and move this to the number 1 position. You can also use the trash icon to the right of the diagnosis to delete anything that you entered incorrectly. Next is the procedures panel. This is where you'll enter the HCPCS code information related to this review. You'll simply click the add button to add a new code to the panel, and then again be able to search by either code or by term. Searching by code, here again, will let you enter a code directly and search for it. This process works exactly the same as in the diagnosis panel. After entering a code or a term to search by and clicking search, the system will provide a list of results to select from. You'll select the radio button to the left of the code. Throughout the system, you'll see in various locations there will be a red asterisk. This indicates that this is a required field. The next section you'll see here is the modifiers, but as you can see, there's no red asterisks here. This is not a required field. The number of units is required, as is the units qualifier. You'll then simply select submit, or again, submit and add another. The next panel is the documentation panel. This is where you'll enter any upload any related clinical documentation necessary for the review to be processed. To submit documentation, again, you'll click add. When you click add, it will open up a modal where you can drag and drop files from your system, or you can select click here, and that'll open up a Windows directory so you can find the necessary files on your system. Please note that all documents do need to be in either PDF or Word format. The file name cannot contain spaces or special characters, and the name of the document can be edited in the name box as applicable. Perhaps when you load it, it says something that meant something to you on the system that you had it on, but doesn't really mean anything here. So you could change it to say John Doe information. Next, you'll indicate the category. The category allows you to select the type of document that you're attaching. This will most always be clinical. Next, you'll indicate the topic. Topic further defines the type of clinical information you're attaching. As you can see here, medical and treatment history was selected. Other options include things like lab values. You'll simply then click upload to attach the information to the review, and you can repeat this process as many times as necessary until all relevant documentation has been added to your request. When all the request steps have been completed, you'll click continue. When you've entered all the requested information and click continue, the system will next take you to this MCG screen. MCG was formerly known as Milliman Care Guidelines. Milliman Care Guidelines or MCG guidelines do not apply to physician administered drug requests. So you can just click Submit Request to bypass this process. The last step in the submission process is to certify that all the information that you've entered is accurate and complete. After reading the certification statement, you'll enter your username here in the Acknowledging User section and click the Submit button in order to send the review to Mountain Pacific. After completing the attestation, you have one last opportunity to add a comment to the request if applicable. Perhaps there's something you want to call specific attention to in the medical notes that you've attached. Say, please make note of paragraph 3. Anything that is pertinent to your request. Again, you'll see there is no red asterisk here. This is not a required field. It's entirely optional. You can just simply click Submit. After submitting your review request, you'll be routed back to the summary page. Here's where you'll get to see the one-page view of all the details regarding the request as you submitted it. You can select Task Queue at the bottom of the page to begin a new search and submit other reviews, or you can use the links at the top again and the navigational icons at the top of the page to navigate through the Qualitrac system. After you've submitted it, you'll want to review the request status and outcomes. Our system will send you email notifications when we've received the review request from you. If you have started a review request but you did not yet submit it, perhaps you got distracted by a phone call, someone came up to your desk, whatever, you started it, but the system recognizes that you did not finish it, did not completely submit it. The system will send you an email as a reminder. Then you can either go in and delete that request if you did not intend to submit it, or you can finish it at that time. We will also send you an email notification if additional clinical information is requested. And last but not least, you'll receive an email when the review outcome has been rendered by our clinical team. After a review has been submitted, you can find the review at any time by clicking on the magnifying glass and completing either a member search or a case search. If you're searching by the case ID, simply enter that case ID in the box and click Search. You'll know the case ID because it will come to you in that first email that you get that we recognize that we have received your request. Then you'll click on the blue link to be directed to that specific review. If searching by using the member search function, you'll be directed back to that member hub. And in the utilization panel, you'll see all the requests that have been submitted. And you'll click on what we call an ellipsis, which is just these 3 dots to the right of the review. And that will open up this little modal here. You'll select View Request to see the status and details of that review. Or if it's not yet been reviewed by our clinical team, you still have the option to delete that request at this time. If our clinical team in the review process has determined that additional information is needed before they can proceed with the review, you will receive an email and a request for information task in the scheduled task queue. Users can access that scheduled task queue in 2 ways. Again, remember here in the top navigational bar, the 3 horizontal bars indicating a task queue, or you can click on the Start Tasks button here, was on the utilization management module that you saw on the landing page. You'll then go to the scheduled task queue and you'll see all tasks that are currently assigned to you. Here's a helpful tip. If you have a request for information task, you can simply click on this blue comment bubble to the left of that task title, and a modal will open up with a note from the reviewer indicating what information they're requesting. You'll open it up and it'll just say something like, please submit most recent lab values. And then you can just click on again, this little ellipsis to the left of the page to start that task. You can also scroll to the correspondence panel in the member hub to view the request for information letter. You'll have the same information request is in there, it's just in the form of a letter. You'll click on the blue letter link to open it and see what information is being requested. Then to attach the additional information that's been requested, you'll scroll to the documentation panel and click the Add button. When you've added the necessary information, again with either that drag or drop or the click here and pull it in, find it on your system and drag it in there, you'll scroll to the bottom of the page and click the Done button. This will finalize the request and send it back to the clinical team to finish the review. When you click Done, that system will return you to that scheduled task queue, and you'll see that that task is no longer assigned to you and no longer visible. We ask that you not start a new review request when you've been asked for additional clinical information. This will just create a duplicate request in the system and will delay the review process. Viewing the outcome. To view the outcome or determination of your request, you'll go to the Member Hub, just as before. Again, find the review in the Utilization Management panel and click on the ellipsis to the right, select View Request. You'll then scroll down to the Outcomes panel in the Member Hub, and the determination will be displayed here on the right. You'll click on the dark brown section of the panel to expand this view and be able to view all the details. In that expanded view, you'll see a Requested tab, which displays the information that you requested for your review. In the Final Recommendation tab, we'll display the determination and that authorization number that you'll need for billing. Next, we'll do the authorized official training. There are actually 3 roles within an organization in order to access and utilize the portal. You'll need a provider executive, an authorized official, and then provider users. Again, the provider executive is someone within your organization who's been permitted to bind your organization to terms and conditions of the provider portal agreement. This person must designate or delegate in writing 1 or more authorized officials for your organization. The provider executive cannot be the authorized official. Again, this is that delegated security model. Each facility is required to have at least 1 authorized official. This person is going to serve as that point of contact for your organization and will be responsible for managing provider user accounts. They'll add or remove provider users as required to support your organization. And in order to do so, they must complete the authorized official agreement and the authorized official registration form. Just a note that the signature of this form must be witnessed by a notary public, again, for security reasons. Provider users will access, or those individuals who access the provider portal to submit and view clinical review requests. Although a provider executive cannot be the authorized official, an authorized official can be a provider user. I know that sounds very confusing, but it's much more simple than you think. And once you fill out the forms, it'll make complete sense. The provider user access will be granted then by the authorized official, and they will be required to accept the provider portal terms of use prior to the initial login. Again, this is pretty standard to most applications. The first time you log in, it just says, I agree to use this in the way that it's intended to be used. You click I accept, and you do that only upon the first time that you log in. The registration packet can be downloaded from the website at this link here. And again, these slides will be posted. All registration packets must contain the provider executive agreement. This is that person indicating who's going to be the authorized official or officials for your organization. Then the authorized official completes their agreement and then provides the details in the registration form. You'll mail those forms by U.S. mail to Telegen, attention Qualitrac registration team at our West Des Moines location. Registrations will generally be processed within 5 to 7 business days from the time we receive them. Once we've received and processed your registration packet, the authorized official, or what we refer to as the AO, will receive 2 emails. The first one will contain your username, and the second one will give you the link to the portal so you can establish your unique password just like any other user in the system. Again, you'll want to click on the link in the email to establish your password within Qualitrac, and you need to establish that within 24 hours of receipt because the link will expire. And again, if you are expecting that email but do not receive it, please check your junk email or contact your IT department to ensure it's not being blocked. Authorized officials will see an additional icon at the top of their menu. These are all the same standard as all the other users, but you'll see this little tool icon. You'll select that tool icon and select Manage Users. You'll then be able to see all the users that have been associated to any organization or providers that you're associated to. The AO can click on any of the blue links to access the details of that individual user. The AO can view all the contact information regarding that selected user. You can see it's primarily just demographic information, their email address, and which organizations they're associated to. The AO can edit all user information except for that username field. Once a username is established in our system, it cannot be changed because it's tied to various review requests. That username would need to be deactivated and a new one established for that user if they would have a name change or for some other reason want to change their username. All usernames must be unique within the system. If you're a Smith, a Jones, a Johnson, or some other name that's common, and someone else within our system already has that username, the system would alert the AO and an alternate username would need to be established. I was a Smith for 30 years. This one's important for me. To create a new user, you'll click the Add User button at the top right corner of the Manage User page. All the fields here, again, with the red asterisks are required fields. And then if you're the AO, the organization dropdown would allow you to only associate users to organizations that are available to you and that have been delegated to you. You'll simply check the box next to each one to select it. And when all required information has been entered, you'll click Save. After clicking Save, the system will direct the AO to the Reset Password page. The username field will pre-populate and you'll simply select Submit. When you do so, the system will send a link to that email address associated to this username, and then they will be able to establish their unique password. The email link will direct the user to this Reset Password page, and here are the rules I talked about earlier. This is the criteria that they will use to create their password, and then click Submit. When someone leaves your organization, they will need to be deactivated from the system. To deactivate a user, you'll simply go to the Manage Users tab, find that username that you need to access. It'll bring up their information here, and you'll click Deactivate User. Important information just to remember, and again, these slides will be out there. This is the website URL in order for you to access the portal. If you need technical assistance regarding the portal, you would dial this number and select option 2. If you have something specific regarding physician-administered drugs and that review process, you'll dial this 1-800 number here. That concludes the training. We'll have the system opened up now so that you can ask questions.
Thank you, Heidi, and great job as always. Just for those on the phone, this is our third training that we've done. All of this stuff will be posted online. All 3 trainings will be posted and available. And as well as any questions or concerns that you have, the contact information will also be posted online. Maynette, are we seeing any questions come through?
No, I'm not seeing anything in chat or the Q&A.
Well, thanks to everyone for attending. Again, if you have any questions, concerns, please use that contact information that's posted. We do look forward to working together. August 10th is just around the corner. We're excited and ready, and if you need anything, please feel free to give us a call. With that, we will end the training.
Thanks, everyone.
Thank you.
Thank you.